Good afternoon. My name is Steph, the Butterfly Princess, the founder of the Butterfly Princess Initiative. Welcome to a latest edition of my vlog, starting a new partnership with the LGBT Foundation. Today I'm joined by Lauren, who works within the sexual health department of the LGBT Foundation. So we're just going to have a bit of a talk about, we're going to be talking about, HIV, Chem Sex, if I pronounce that right, and how you can get tested for HIV, what you can do to protect yourself, and also how the pandemic has changed people's, sex life and how they go about having sex. So there's going to be quite a bit of adult content in this. So just to pre-warn that, if there's certain aspects that you don't want to listen to or you find offensive or whatever, obviously won't be offensive or harsh intentionally, but if there's anything you don't feel comfortable with, switch off at any point. So I'll pass you on to Lauren now.
Hiya. So thanks for that introduction, Steph. So yeah, I am Lauren. I manage the sexual health programme at LGBT Foundation and I use she, her pronouns. And to start off with, Steph's just asked me to explain a little bit about the organisation and what it is we do. So we are based in Greater Manchester and lots of our services are wider than that. So we offer lots of services for LGBT people across the country and across Greater Manchester. That includes things like support with things like domestic abuse and with substance use. We offer lots of talking therapies and wellbeing support. And then obviously within my team, I offer sexual health testing, lots of education around sexual health and spaces for people to talk about what it is they want to get from the sex that they're having.
So with on that, so obviously with LGBT people, it could be two women having sex, it could be two men having sex, or transgender people. So are the sexual health services in particular, because that's what we're focusing on today, are they quite well used by some of the people you support? Like, what are some of the sexual health issues that people come to you with?
Yeah, I mean, I think it's really important as well for us to acknowledge that as much as when we talk about LGBT sexual health, people quite often assume that what we're talking about is sex between men or sex between women. But for lots of people, they're having sex with partners of other genders. And although by the outside world, sometimes that's viewed as kind of heterosexual sex, if you're an LGBT person, it doesn't matter what kind of sex you're having. And there's a big difference as well between the types of sex that you might be having and the people that you're attracted to. So for lots of people, they're having sex with partners of multiple genders, but they're only romantically attracted to one gender, or maybe they're having transactional sex with one gender and the sex that they have in their personal life is almost with a different gender. So we don't want to limit people's access to our services based on what they're doing. So sometimes people say, oh, well, I'm bi, but I'm with an opposite gender partner at the moment. Does that mean that I can't use your services? It absolutely doesn't. We want to work with all LGBT people with whatever they need. But like you say, there are specific issues that we often work with. So LGBT people, particularly men who have sex with men, tend to be at higher risk of acquiring STIs. And also what's really important for me in my work is to look at the history. So over a period of time, HIV has been seen as a huge public health threat, particularly to gay men. And you know, homophobia has meant that in schools and in public places there were periods where there was no discussion of any kind of LGBT sexual health topic, or even any topic related to LGBT relationships. So for a lot of people, when they come to talk to us, it's the first time that they've kind of been given information that's really relevant to them.
Right. Talking about the history of like LGBT and stuff, I mean, there was a programme recently, wasn't there, on Channel 4 called It's a Sin,
Yeah.
and that was about, you know, some friends who were members of the LGBT community, especially in it was set in the 80s, and that's when the UK had a big AIDS pandemic. So do you think from like people watching that series, they've like changed, it's helped people change their attitudes towards, you know, gay men and sex and HIV?
I think so, yeah. I mean, we saw a lot of people come to us after that programme aired, saying that they'd, you know, learned about things they'd not heard about before, or they'd kind of had almost like a new emotion attached to something that they knew a little bit about, but they didn't really understand. And that's really, really good. But I think what's also really important is to think about media showing what it's like today. So obviously It's a Sin was brilliant in terms of showing what really happened to communities during the AIDS crisis during the early days. But actually HIV is not really like that anymore. It's much less scary. You're not going to die from it. It's treatable. And that's the part that people often don't know about. And that's the part that I really want people to know about, is that if you do have HIV, like, all you need to do is get tested. There's support out there. There's treatment that will help you stay healthy and stop you from passing it on to other people. And it really isn't that people are dropping dead after contracting HIV anymore.
So, like, talking about testing and like treatment, so obviously you do testing within the LGBT sexual health and foundation in that respect. So what does it involve, the testing process, and what treatments are available?
So it depends on what you've been doing sexually, and it depends a little bit as well on the body parts that you have. So for example, for people who have a vagina or a front hole, it's likely that an STI test would include a urine sample. Sorry, wrong way around. It's likely that the STI test would include a swab of that vaginal canal. And for somebody who has a penis, it's likely that that would include a urine sample. And then on top of that, you'll also do things like throat swabs and anal swabs, depending on what type of sex you've been having. And we might take a little bit of blood as well for HIV and syphilis. But people often really worry about how those tests happen. So people think that you go into a service and somebody says, okay, take your pants off, I'm going to swab you, put something down your penis, and it's painful and it's embarrassing. But actually, a lot of the data that we now have shows that people doing swabs themselves means that not only is it much more pleasant in terms of the patient experience, but actually it's a lot more effective. But people get the right bits. They can reach in, they know where to feel, they can feel it and get kind of the feedback from doing it themselves. So I think people really still worry, particularly men who've been told, like, oh, if you go, they'll go and stick something in your penis, and it's really not like that. The only time that people would need a physical exam is if they've got some symptoms. So if there's some sores or some discharge, and in that case, if they went into a medical sexual health service, it might be that the nurse or doctor says, okay, let me have a look. But it's certainly not going to be shoving things in there and hurting you.
No, of course. Yeah. So, like, obviously, so do you know of, like, obviously we've talked about the testing, and but I mean, obviously, it's that the test specifically for HIV, or is there a specific test for HIV?
Yeah, so a HIV test, because it's a blood-borne virus, you'd be looking at blood. So there's a few different types. The type that we tend to do is called a dry blood spot test, which means that we take a little bit of blood from a fingertip, pop it on a piece of paper, and then we send that to the lab to be looked at under a microscope. We also offer rapid tests, and again, finger prick. So it's a really small amount of blood. And we can run that test ourselves and give you the result there and then. But the difference between them is that the window period changes. So that means the period of time from potentially getting an infection, so you have sex, and then how long do you wait until you get the test? And that varies for different test types and different infections. So for example, chlamydia and gonorrhea, that's 2 weeks until you can get an accurate result. But for HIV, it's a bit longer. So a lab test where they look at the blood under a microscope, so that might be, like I say, the dry blood spot test or a sample taken in a clinic from your arm. They tend to be about 4 to 6 weeks until they get an accurate result. And then for the rapid results, it's longer, so it's up to 3 months, which in a way is really useful, because if you do both tests at the same time, you can then almost work out when an infection was kind of present, because if one's positive and the other's negative, then you can kind of say, okay, well, within this time frame, at this point you didn't have HIV and at this point you did, which is great and really helps with things like you know, when the clinic wants to tell your partners and get them in for testing as well.
So, like, what treatments are available for, like, you know, AIDS, well, like HIV and these other treatments for the other sex STI? Because, like we said, you know, HIV is now treatable. It's not necessarily a death sentence as it was 40 odd years ago. So, what sort of the treatment options are they available?
So it depends. If we're talking about HIV specifically, then HIV is not curable. So once you have it and you're on treatment, you do need to be on treatment for the rest of your life. But for a lot of people, that's really simple. So there are tablets, which mean they essentially keep the amount of HIV in your blood to a really low level. That means you can't pass it on and you won't get ill. So for lots of people, that's just one tablet every day. And there's lots of really new types of treatments being launched all the time as well. So within the last few months, both in Scotland and in England, the NHS have started offering an injectable treatment, which is really exciting, because that means that for the first time, people who have HIV don't need treatment every day. They just need an injection every couple of months and then they're covered, which is really exciting. I think, you know, we think about HIV as being something that's been around for 40 odd years, but in the history of medicine, that's not a long time at all. So we're still seeing new things happen all the time.
So obviously, when I was doing this research from this interview, obviously that's how I came up with some topics that you've seen, and one of that was I thought, well, for me it sounded really intriguing, because I've never come across a term called Chem Sex. And what's that? Is it to do with drugs and all that, and that can increase the risk of developing HIV? Because again, does it involve having sex with multiple people? And
yeah, so ChemSex is a term which is kind of used to refer to people using drugs during sex, but there are a specific set of behaviours and almost cultural circumstances that tend to be surrounding chemsex. So for lots of people who have chemsex, they do it at the weekends. They take drugs to either allow them to have types of sex that they wouldn't have otherwise, or to enjoy the sex more. And then during the week they go to work and they manage it absolutely fine. So I think it is always important for us to say that chemsex isn't always a problem for people, but because of the use of drugs in sex, it does mean that there are more ways to get infections. So Depending on the ways people are using drugs, that might be an infection risk. So if they're injecting drugs or sharing needles, or if they're snorting, that could be a hepatitis risk. So what's really important to do is not share any drug using materials. So if you're going to be injecting, use your own needles, don't share with other people. If you're snorting, again, use a straw that's just for you, don't share with other people. And then the things that can increase sexual risk is that often at ChemSex parties there are groups of people, so you might be having sex with multiple people. I don't know about you, but I know that when I'm drunk or kind of under the influence of anything, then sometimes my priorities change, and so people, they might do things that they might not otherwise do. So for example, they might have sex without a condom when if they were sober they would say, no, want to use a condom. So I think it's really important for people to kind of work out what their boundaries are before they go into that situation, so that when they're there they can say, actually no, that's one of the things I said I wasn't going to do. And of course also drugs facilitate sometimes rougher sex. Sometimes you might not notice if you're in pain, and what we don't want to be doing is having any tears in vaginal or anal skin, because of course again that increases infection risk. So just go prepared with equipment to help with safe drug use, equipment to help with safe sex, whether that's PrEP to avoid HIV, or whether that's condoms to avoid any potential pregnancy or bacterial STIs. And like I say, it can be done safely, but also if people are struggling with it, there's lots of support out there.
Just a few more questions, if that's okay.
Yeah.
Obviously, we've been living with the COVID-19 pandemic, and when we were in lockdown, we were told, oh, you can't mix with anyone outside your household, so that would have. We were advised, not to have sex with anyone that we didn't live with. If you didn't live with your partner, don't have sex, go and have sex with them. And I suppose that impacted on the LGBT community as well. And I suppose it had an impact on the sex industry, when people, because many, I'm not sure, obviously this is true, obviously with heterosexual people, but a lot of LGBT people engage in sex work, don't they? So I suppose, how has that changed during the pandemic? I presume a lot of stuff's gone online,
Yeah, definitely. I think everything's gone online, hasn't it? People are working online, all of people's medical appointments and things are online, and that's been really hard in terms of communicating with people, because LGBT people, not to generalize, but as a community, LGBT people are much more likely to experience isolation in general. They're likely to have been rejected by family or have limited social support. And for lots of people, their interaction with other people does come from sex, which isn't something that I'm ever here to judge, but obviously is something that's become really hard over the pandemic. And particularly when there was lots of media articles focusing heavily on, don't have sex. And I think it was The Sun who ran a headline that was something like sex ban. For me, what that does is not stop people from doing it, but it stops people from accessing support that they need. And so I've heard stories, for example, of people needing treatment for STIs or people needing emergency contraception, but actually being way too scared to go and get it because they think, oh, well, actually I've broken the law, so maybe I'll be prosecuted if I can go and get this support, which isn't ideal by any stretch of the imagination. And then you think about sex work, and so obviously lots of people were doing online sex work anyway, and they've continued, but actually lots of people who were doing in-person sex work might have tried online sex work for the first time. They might have noticed that their financial situations become less stable because lots of their clients might not be paying for sex. They might have felt like they need to take on clients they would usually reject because, there's less clients about buying sex. And so, again, like one of the things that we did over the pandemic was create a resource specifically around safety for sex workers during and after the pandemic, and that covered lots of things like financial support for sex workers and physical support, how to report violence to the police and how to set boundaries with clients. And hopefully, that will be something that we see getting a lot easier over time as we come out of the pandemic. But what's really interesting to me is that in the same way as we talk about a hybrid model of working in the future and what is the new normal, and surely we're not going back to the same way, I wonder if the ways in which people have been using technology to have sex are going to kind of continue to stick around and change. So, for example, I've heard of people having lots more video sex. I've heard of people doing lots more like sexting and sharing pictures and things like that, which is absolutely fine. I think, as with everything, and I've said this loads of times about topics, you've just got to do it carefully.
Yeah, what you do is your business, really.
Yeah, absolutely. Go and do whatever you want, and if it feels great, then that's brilliant. But just make sure you're doing it safely and think about how to keep yourself safe.
One more question. I first knew of LGBT Foundation from attending a sexual health workshop just for research that you did in partnership with Health Watch Berry, because I do a lot of work in partnership with Health Watch Berry, and it was Abe and he presented that workshop. So that was just one workshop, but do you do a variety of different workshops on a variety of different subject areas?
Absolutely, yeah. What we tend to do is we have a structured set of workshops which we have and we'll kind of do for different groups or at different events, but we also do lots of standalone events. So I would say the best things to do are to have a look at LGBT Foundation, lgbt.foundation/sexual health. And on there's a whole list of our workshops. And also, if you have a look at lgbt.foundation/events, if we've got any kind of standalone events, film screenings, things like that coming up, they'll be on there too. I find them really fun. I mean, I know you came to one of our workshops, but one of the things that we really try and do within our workshops and group spaces is keep away from the traditional fear-focused sexual health stuff. So I don't know about you, but at school I had next to no sexual health education.
Oh no, that was the same for me, you know. It was just to be, no one talks about it.
Yeah, and particularly for, LGBT people or people with disabilities or people who are neurodivergent, it's very likely that doesn't work for them. They've not got the information that they need from that. And so the last thing that I can imagine somebody voluntarily coming to is almost a rerun of those school sex ed sessions. So we keep it really fun. We focus on well-being and having a good time and talk in a creative way. So sometimes we do things like life drawing to talk about body image. Sometimes we might do film screenings or just have a bit of a discussion group. And the priority is thinking about sexual health and well-being. So it's not just stay safe and wear a condom, but it's also, are you talking to your partners? Are you having the best time? Are you getting what you want out of the sex you're having? Because sex is as much about pleasure and like mental health and well-being as it is about, physically staying safe.
And finally, before we finish, how can people get in contact with you, if they need support or they want to access your services?
Yeah, so I would say it depends on what exactly we want. So if it's sexual health specific, then either take a look on the website and find the page for whatever thing you want, or just email us. We've got an email which is sexualhealth@lgbt.foundation. Or if you want broader support, you just want a chat, or you think you'd like to access some of our other services, then I think the best thing to do would probably be to either email helpline@lgbt.foundation or to just give our helpline a ring. It's 0345 330 30 30, and I'll put the contact details in the description when we post this video.
Thank you, and thank you very much, Lauren, for joining me today, and thank you for letting me to interview you. I think we've touched on every topic we discussed, didn't we?
Yeah, we did. Yeah, it was a good list of topics.
Yeah, thank you, and I hope I'll be able to do more of these vlogs with other members of the team. But thank you for your time today.
No worries. It was lovely to talk to you, Steph.
Thank you.